We're going to discuss one of the most interesting topics in cosmetic and aesthetic dermatology, which is the microneedling radiofrequency. And I think the webinar is going to start within a few minutes. I really appreciate all those who are attending today, and hopefully it's going to be a fruitful event. And definitely I would like to thank the Kuwaiti Dermatology Society for hosting us and being a sponsor for this meeting. And also I would like to thank Dar Pharma for arranging that webinar and giving me the opportunity to be attending tonight with all the colleagues from everywhere, including Kuwait.
Hi all, thank you again for attending this webinar and thanks for this huge number for attendances. Again, continuing to what Dr. Ashraf said, we are thanking all doctors, all medical team who's attending this webinar. On behalf of Dar Pharma, we are thanking the Kuwait Society of Dermatology, and we hope that you will enjoy this webinar and as usual get the most updated and beneficial information from Professor Ashraf Badawi. In the beginning, I just would like to introduce Dr. Ashraf Badawi to all attendances. Maybe some of them not too much aware about his professionality, certificates and positioning. Dr. Ashraf is the president of European Society of Cosmetics and Aesthetic Dermatology, vice president of European Society of Laser and Energy-Based Devices, co-chair of the Laser Task Force at the European Academy of Dermatology and Venezuela. First of all, we will go through the webinar schedule, and we will do our best to go through all points, hopefully, inshallah. First of all, Dr. Ashraf will go through the skin layers, normal versus the damaged. Then he will go for the clinical cases and discussion. The following part would be illustration of microneedling treatments, moving to fractional RF, then microneedling with RF, then microneedling radiofrequency versus CO2 treatments, and ending with VIVACE, the device of microneedling, which we will reflect the webinar today on, and then when, why, and how. And last part of this webinar will be the questions and answers. Because the number is huge, as we said previously, I would ask all attendances please to cooperate with us, and in order to make this webinar comfortable for you all and to make it successful and to allow you to get the most part of the presentation details, I would ask you all to keep mute and to close your cameras, just to keep the to save the pressure, because we have a pressure on the signal here. Thank you all again for your attendance, and Dr. Ashraf, if you're ready, please start.
Thank you very much, Dr. Muhammad. And as mentioned before, it's a great pleasure to be with the colleagues. We have been away from seeing each other due to the COVID-19. Hopefully this is going to be over soon with the era of the vaccination, and hopefully next time we are going to be face-to-face in one of the events all over the world. So before discussing and going into the technology directly, I always like to think of the pathogenesis. We need to understand well the problem we need to fix. If we don't understand well the problem we are dealing with, we are not going to get the best tool in order to deal with the problem, or at least we are not able to utilize the tool properly in order to overcome the problem we have. So in order to understand the problem, it's important to go through the skin layers and what happens to the skin layers along with aging process and in different pathologies in order to understand how a certain technology is going to work or improve the skin. So it's important to know before we go to the pathology, the characteristics of the healthy skin. So for the skin, in order to be healthy, it has to be smooth. And this smoothness of the skin requires normal keratinization. If we start to have hyperkeratosis, we are losing the smoothness of the skin. One of the most important features people are trying to keep or get back if they lost it. So normal keratinization is a key in order to have smooth skin, and this is something which is disturbed very early in life with the photoaging and photo damage. Then the healthy skin is firm, and this requires abundant, normal functioning collagen and elastin. So when we start to lose collagen and elastin, we lose the firmness of the skin. And when we lose the firmness of the skin, we start to have laxity, we start to have wrinkles, and we start to have larger pores. So the normal functioning collagen and elastin, it is really very important. It's very important to remember that we start to lose collagen and elastin very early in life. Starting from the age of 20, we lose 1 to 2% of our body collagen every year, annually. And moreover, the areas which are exposed to the light, and I insist on saying light, not only sun, even daylight lamps are emitting ultraviolet, is accelerating the degeneration of the collagen and elastin. And that's why the quality of the skin in the sun exposed and light exposed areas in our body is less than the quality of the skin in the hidden areas and protected areas. The healthy skin is evenly colored, and this requires properly functioning melanocytes. If we start to have hyperpigmentation or hypopigmentation, this does not show healthy skin. And this is one of the most important motives for people to seek treatment and advice of dermatologists when we start to have disturbance in the skin pigmentation. The healthy skin is properly hydrated, and this requires intact barrier function. When we start to have disturbed barrier function, there is increased and accelerated transepidermal water loss, which is leading to skin dehydration. Skin dehydration is associated with loss of skin elasticity, and we start again to see rough skin, not smooth. We start to see large pores. We start to see wrinkles because of the loss of skin elasticity. So as a matter of fact, the proper hydration of the skin is very much linked to the normal keratinization. Those are going hand in hand with each other. So it is really very important to remember whenever we are having a problem, a patient complaining of a problem beyond the surface of the skin, that restoration of the epidermal barrier function is very important in order to have smooth and well-hydrated skin. The healthy skin is free of medical diseases, and that's why when we have eczema, atopy, psoriasis, vitiligo, then we need to treat the skin in order to restore the healthy appearance of the skin as much as we can. And finally, the healthy skin is free of environmentally induced deterioration, a process which happens on daily basis. So as long as aging is a dynamic process, rejuvenation also has to be dynamic. And this is the answer of those who are asking you, if you are doing 3 sessions of laser for me, or if you are doing whatever procedure for me, how long is going to stay? We tell them how long it's going to stay, this procedure, but they have to understand that aging is a dynamic process. Every day we are exposed to the environmentally induced deterioration. So rejuvenation also has to be dynamic. We do certain procedures multiple times, and then we do maintenance in order to keep the skin in good shape for many years to come. So this is very important to remember. This is very important to evaluate whenever we are having a patient coming to complain of whatever problem it is. If we have a patient coming to complain of melasma, for example, the melasma, the problem is here in this area, the properly functioning melanocytes, it's not properly functioning. So we focus our efforts on improving the hyperpigmentation. This is what we all do. But we forget that besides improving the pigmentation, it is very important to evaluate the other elements of the skin. It's very important to make sure that the patient is having normal keratinization, the patient is having firm skin, the skin is properly hydrated, and we are doing something for the environmentally induced deterioration. This is how we do a holistic approach. It is not good to pinpoint the problem. It's very important to evaluate all the elements of the skin and work on it in order to improve the appearance and the function and the structure of the skin in general. That person or that patient who came to complain of melasma, we all know that we are not able to cure the melasma. Once melasma, always melasma. We know that whatever we do is going to induce some remission of the melasma, but it's going to recur. So the patient will be dissatisfied. However, if you are able to improve the appearance, the functions, and the structures of the skin, then this patient is going to be happy when they look at the mirror and see that their skin in general improved. And the same applies if someone is coming to complain of acne scars. Acne scars, we know that the problem is in the dermis. However, it doesn't mean that we don't have laxity. It doesn't mean that we don't have epidermal barrier dysfunction. And when we improve all the other aspects of the skin, whatever achievement we are able to get in improving acne scars is going to be reflected much better on the overall appearance of the skin. So this is a wake-up call in order to avoid telescopic vision, and in order to deal with the skin, regardless what problem the patient came with, in a holistic approach and improving all the elements of the skin so that we are able to improve the appearance of the skin in general. So it's important to remember that the skin is composed of 3 layers: the epidermis, the dermis, and the subcutaneous fat and tissue. And each of those layers is undergoing certain changes with aging, which is affecting the structure, hence the function, hence the appearance of the skin. And regardless where is the problem the patient presented with, the other layers of the skin has to be evaluated with designing a treatment plan which is going to tackle all the layers of the skin which are having any pathology or changes in the structure and the functions. One of the big objectives of the rejuvenation is improving the epidermis and restoring the epidermal barrier function, where with the photoaging, we start to have hyperkeratosis, we start to have less living cells, and this is affecting the epidermal barrier function. So it is important to have a step which is restoring the epidermal structure so that we are able to have more living cells and less corneocytes, less hyperkeratosis, so that the epidermal barrier function is restored. The absorption of topically applied agent is going to be much better, and the skin viability is going to be much better when we are able to induce that change in the epidermis. At the level of the dermis, it is important to remember that we are getting elastosis, we are getting loss of collagen and elastin in the upper dermis. So we are going to have, as we can see in this histology, loss of collagen. So we need to do a procedure which is going to induce neocollagenesis, rebuild the collagen in the upper dermis. This is how we are rejuvenating the dermis. And finally, if there is a degree of skin laxity, then we need to have something to tighten the skin. When we do that, then we worked on all the skin layers in order to rejuvenate the skin. If the patient is having skin laxity, which is not addressed, or the patient is not realizing, after doing a good job at the level of the dermis or the level of the epidermis, the patient will come to tell you, I'm happy with what you did. However, now I have laxity. I didn't have laxity before. So it is really very important to address all the problems the patient is having, design a treatment plan in order to tackle all the problems at all the layers of the skin so that we are doing an optimum job. Sometimes we are faced with challenging situations clinically. So we have this patient in front of us, dark skin, skin type 5. She's having some acne scars, active acne, and it is really challenging to work on those individuals because if we are using energy-based devices emitting heat, significant heat, we can end up by having hyperpigmentation. The same happens if you are trying to do chemical peel for them. So we have to be smart how to deal with such a patient without inducing side effects, improving the skin without risk. This is a big challenge. Another challenge I'm facing, and I'm sure many of my colleagues are facing, is the large pores. whatever we do, we are a little bit limited with the improvement. If we try to do fractional lasers, in many cases we are ablative fractional lasers. In many cases we are ending up with hyperpigmentation, or sometimes the patient is not very happy. And the reason of that is that in order to improve the pores, it is really very important to know that the pathology is not only in the dermis. Inducing neocollagenesis is not going to be the only thing which is going to improve the situation. We need to work on the epidermis to restore the epidermal barrier function, so the elasticity is going to improve, and hence the pores are going to shrink partially. Then doing something to stimulate the collagen, and microneedling might be one of the best tools to do that. In addition to that, if there is a degree of skin laxity, tightening the skin is going to help making the pores smaller. So it is really very important to work on all the layers of the skin to tackle a problem like the large pores. In many cases, like acne scars, deep wrinkles, stretch marks, dilated pores, we are going to see that the microneedling might be one of the most successful tools in order to tackle that. And when the microneedling is associated also with some radiofrequency, then we are getting the enough heat in order to shrink the collagen fibers, which is going to help us in getting the best outcome, as we are going to see. In general, the message here is that we need to approach what's called three-dimensional rejuvenation, where we are targeting the epidermis, the dermis, and the subdermis for tightening. And I don't want to dictate a particular type of treatment. This is something which is going to depend on the expertise and the tools and the machines you are having at your clinic. However, if we talk about the epidermis, what are the remedies? What are the tools we can utilize in order to improve the epidermis? This can be prescribing retinoids. It can be doing chemical peels, keeping in mind all the precautions and the preparations required for the skin before the chemical peels, and the care required after the chemical peel to prevent hyperpigmentation. The microdermabrasion with the different types and modes, and the modern types of microdermabrasion, like the Mira peel, like the other similar procedures, which are improving the epidermal barrier function by mechanically removing the hyperkeratosis, stimulating the regeneration of the living cells. This is definitely improving the epidermal barrier function. Finally, you can do laser peel. Laser peel is removing part of the epidermis. However, this requires very good preparation, very good care of the skin afterwards. Otherwise, we are going to be ending up by hyperpigmentation. So those are the different tools which we can utilize in order to improve the epidermis. Everyone should select one of them according to the expertise and the tools available at the clinic. Then the dermis. To improve the dermis, what are the options? We have the skin needling with the different derma rollers or mechanical motorized rollers. We have the microneedling radiofrequency, which is associated, microneedling associated with radiofrequency, and we'll discuss that in details later. And also we have different types of lasers, whether the non-ablative lasers or the fractional laser, whether ablative or non-ablative fractional lasers, all of them are going to improve the dermis. Then we need, in some cases, if there is skin laxity, we need to tackle the subdermis as well. And the tools in order to tighten the skin might be the radiofrequency, might be the infrared light and lasers, the HIFO, the threads, and surgery. All those are tools, different tools, in order to improve the skin laxity. The most common mistake I have seen is that a patient coming with acne scars, and this patient went to 3 or 4 clinics where they did for him fractional laser, and then he was not very satisfied with the outcome. So he went to another clinic where they did for him microneedling, and then he was not very satisfied. So he went to a third clinic where they injected him with PRP, with plasma, and so on. The mistake here is that everyone is tackling only the derms. No one started to work on the layers of the skin in order to have a holistic approach and treat and improve all the layers of the skin. So it's really very important to make sure that the treatment plan we are designing for any patient is targeting the different layers of the skin in order to restore the structure and the function of the skin. This is called rejuvenation. Rejuvenation means restoration of the structure and the function of the skin. And this is what we are supposed to do, not a temporary fix. When we are injecting fillers for someone, it is going to give us immediate improvement of the appearance. Now, the question is that improving the structure and the function of the skin? Maybe yes, maybe not. So I'm not going to judge anything, but it is very important to work on the restoration of the structure and the function of the skin so that we're achieving rejuvenation and some sort of anti-aging effect for the patient we are treating. So as today we are talking about the collagen induction therapy and the microneedling radiofrequency. So the collagen induction therapy by microneedling radiofrequency is one of the most recent and advanced treatments, and I think this might be the most successful addition to the armamentarium we have in the field of cosmetic and aesthetic dermatology. So this concept is comprising two different concepts, the needling and the fractional radiofrequency. Those are two different concepts we are combining together in order to come up with improvement of the skin in a very safe and unique way. So the concept of needling started with the derma rollers, which is a disposable device. And I insist on mentioning that it is disposable. This is a tool or a device which should never be utilized more than once, even if it is for the same patient. I insist on that. So this roller used to be used over the skin after applying the numbing cream, and the reported improvement of acne scars and other conditions of the skin was including acne scars in young patients and older patients, and improving of the static wrinkles was outstanding. And in combination with topical mesotherapy, it was utilized in order to increase and enhance the transcutaneous delivery of those vitamins, and very significant improvement of the skin was achieved. This is a procedure which is associated with no or minimal downtime, so we can see the skin 5 hours after the procedure where it is almost recovered. So it is considered very safe, and it can work on all skin types without any problem. So we can see that we apply numbing cream, we remove the numbing cream and start to roll this derma roller on the skin in different directions. We're going to see some pinpoint bleeding. However, just after the procedure, the bleeding is stopped. There might be some erythema for a couple of hours, and that's it. We can see that even the acne scars in darker skin types can be treated, especially in young people where heating is not very much required. But we can see the improvement in the texture of the skin, which is achieved in few sessions. After the derma rollers, we got the motorized rollers, which is mechanically working on the skin. The motor is vibrating or oscillating those needles into the skin. So it's a quick procedure. There are some claims that the pain might be a little bit less. However, there is no heat generated. And when we don't have heat generated, then the potential risk of post-inflammatory hyperpigmentation is nil, because we know that PIH is happening due to the heat. So when we are doing mechanical needling of the skin, there is no risk of this kind of needling procedure. Now, in 2006, there was a very interesting article published in Nature magazine, one of the very important journals. And this was talking about electrical signal control, the healing of the skin. And the principle of this article, or the conclusion, what they found, is that inside our cells, there is a negative electrical potential of minus 50 to minus 70 millivolts. And this is in the resting potential. Without any trauma to the skin, this is the case. Inside our skin, there is a negative electrical potential ranging between minus 50 to minus 70 millivolts. When we get injury or a wound, this is going to stimulate a healing process, healing mechanism. And in this study, they found that this negative electrical potential will jump up from minus 50 millivolts up to minus 100 millivolts. And this was one of the most important reasons for the healing and stimulation of the healing process, the increase in the negative electrical potential. Now, it was found that when steel needles are inserted into the skin, because they have their own electrical potential, this negative electrical potential inside our cells is increasing not only to minus 100 millivolt, but to minus 150 millivolts. And it was found that this increase in the negative electrical potential is associated with significant increase in the regeneration process of the cells. And that's why when we do needling of the skin, the regeneration is stimulated significantly. Is this the only mechanism of action of the needling? No. It was found that when we insert multiple needles into the skin, there will be a mild inflammatory reaction stimulated. And we know that one of the most important acute inflammatory cells is the fibroblasts. And the fibroblast function is synthesis of new collagen. So we are stimulating an acute inflammatory response, and this will invite fibroblasts. Fibroblasts will synthesize new collagen. In addition to that, when we insert multiple needles into the skin, we are going to see that there is hyperemia, increased blood circulation into the area. And with the blood circulation, we are getting more nutrients and more growth factors to the area. And this is increasing the viability of the area we are treating. So we can see that there are multiple mechanisms of action of the needling of the skin. As a summary, we increase the negative cell potential, and this is associated with more stimulation of regeneration, increase the local blood circulation, and this is going to bring more nutrients and growth factors, stimulate mild inflammatory action, and this will invite fibroblasts to synthesize new collagen. And in cases of scars and fibrotic tissue, the fibrous tissue is breaking and fragment the fibrosis. Why? Because with the inflammatory action, we get an enzyme called collagenase, and this collagenase is going to eat up the fibrous tissue and the fibrosis, so fibrosis will diminish in the area of the scar, and that's why we can use this for scars. And also, it was found that the absorption of topical agents is going to increase, and this was proven in a thesis introduced in the University of Marburg in Germany, where they applied some liposomes on the skin, and they measured the penetration, and they found that maximum can penetrate is 0.3%. They did microneedling on the skin, and they applied the same liposomes, and they found that after the needling, 200 times more substance was delivered to the skin. So this means that whatever we apply on the skin after the microneedling is going to be significantly absorbed. This is something which can be very useful if we are applying the right agents, but also it can be very harmful if we didn't choose what we apply on the skin after the microneedling, because if it is something irritating, the irritation is going to be multifold. If it is something allergenic, it can be, the reaction can be very strong. So it's very important to remember that we are increasing the transcutaneous delivery of whatever we apply on the skin after the microneedling. So we have to be careful what we apply after the microneedling. We can get benefit by enhanced delivery of topicals like cosmeceuticals, like biologicals, PRP. In many cases, we do the PRP injection in the areas where we need to inject, but we keep a little bit to apply on the skin after the microneedling so that it is absorbed significantly and it enhances the viability of the skin. And also pharmaceuticals can be applied sometimes topical after the microneedling procedure. So this was about the microneedling. What about the fractional RF? This is associated with more reproducible results than the bulk heating of the radiofrequency. We know that with the radiofrequency, sometimes we don't get very good results. Sometimes we get very good results. And I think all depends on the amount of subcutaneous fat, because when we have extra fat, then the heat generated is going to be more and the radiofrequency is going to be very effective. If we have someone who is having laxity, but with less subcutaneous fat, then the heat generated is not going to be enough and the patient is not going to get use of the procedure. But with microneedling, it is much more associated, because at the end, the needle depth is going to the dermis, where we have enough water to generate enough heat and to achieve whatever results we want to achieve. This was a study about bipolar fractional radiofrequency treatment-induced neoelastogenesis and neocollagenesis. And actually, this study was studying the genes involved in dermal remodeling I will discuss the fibrillin, the tropoelastin, the procollagen 1 and procollagen 3. And we can see that the mean value was very low in the control. Immediately, there was a little bit of increase, but then in 28 days, we can see the significant increase in the values of those important markers compared with the control. So when we are having those elements in the skin increasing, the fibrillin, the tropoelastin, procollagen 1 and procollagen 3, this is a long-term improvement of the skin structure. It is not a temporary edema or erythema, which is going to go away within a few days or a few weeks. No, this is something which is going to improve significantly. So this is showing in the same study the procollagen before and after. Before 4 weeks after the final treatment, and we can see the significant increase in the procollagen 1, and this is in the fibrillin 1, and also this is the baseline, and this is 4 weeks after the final treatment, and this is another patient, and we can see the increase in the number, in the amount. And this was another study showing the histology after the fractional radiofrequency treatment, and we can see that the elastin, the collagen, increased significantly compared baseline with the 4 weeks after treatment. We can see much more collagen in that patient, and the same applies for the elastic fiber, where we can see the comparison of 4 weeks after the final treatment with the baseline, where we can see significantly more elastic fiber in the skin. And this was another study which was talking about human fibroblast-derived multiple peptide factors and the use of energy delivered devices in Asian patients. And we can see that they found that the microneedling frequency was associated with very significant production of human fibroblast-derived MPFs during the wound repair. And this was happening in a very safe way because the heat generated with the microneedling frequency is very controlled and it's not associated with any type of side effects. Now, when we are talking about Asian patients, I just would like to remind everyone that Asian skin is very much prone for hyperpigmentation. So we are very sensitive when we are dealing with Asian patients because we don't want to improve a problem and then get post-inflammatory hyperpigmentation. So that's why it is really very important to make sure that we are using a tool which is safe and effective at the same time. So when we are combining the needling with RF, so we have multiple benefits. One of them is that we are able to get controlled heating of the dermis and subcutaneous tissue. This is giving us safety and efficacy at the same time. We are getting enhanced dermal collagen remodeling. We are getting immediate change in the collagen structure because of the heat, plus long-term stimulation of neocollagenesis, which is happening 4 to 6 weeks after the treatment. So it's important to let the patient know that when we are doing this procedure, sometimes we get very quick results because of the immediate heat and shrinkage, but in many cases, the optimum result is going to be achieved few months after the last session because the maturation of the collagen is going to take some time to happen so that we are getting the efficacy increasing gradually by time. So today we are talking about this device, which is called VIVACE, and VIVACE is a microneedling radiofrequency device, which is very unique. And I can say that again and again, I have utilized most of the micro needling radiofrequency devices, and now this is the one I'm using mostly, and I'm very happy with the outcome of this. Now, with a fractional radiofrequency, you can have non-invasive radiofrequency, but we have the radiofrequency microneedling. The non-invasive radiofrequency is definitely more appealing because people hate needles and hate pain. So we can use the non-invasive radiofrequency. However, it is not going to be as reproducible and as effective as the microneedling radiofrequency because we discussed already the different benefits of the needling of the skin. One of the most important points which we need to discuss today is the difference between insulated and non-insulated needles. There are companies which are producing non-insulated needles and others which are producing insulated needles. So what is the difference? The difference is that the non-insulated needle the needle is emitting the radio frequency all through the shaft, which is inserted into the skin. So this is going to target all the layers of the skin according to the depth of the needle we are using. So it can target both the epidermis and the dermis. The RF area in this case is going to be much wider than with the insulated needle. The insulated needle is not emitting radio frequency except at the tip of the needle. So all the length of the needle is not going to have radio frequency, just the tip is going to emit the radio frequency. And that's why the RF area is narrow. The effect of the non-insulated needle is just going to be like the radio frequency with the laser, whereas the insulated needle is going to have an effect which is very similar to the RF and HIFU. So this is the difference between the two types of needles, insulated versus non-insulated. Now, the companies which were producing insulated needles were claiming that this is safer because the epidermis is not affected, so we are not going to have any epidermal injury, and this is going to be safer. The non-insulated needle guys were saying it doesn't make a big difference because the heat generation is going to be very much dependent on the water content, and the water content of the epidermis is 7 times less than the water content of the dermis. So the heat generated at the level of the epidermis is much less, significantly less, and that's why even if we are using non-insulated needle, we are not supposed to have any epidermal injury because the heat generated at the level of the dermis is significantly less, so we don't have injury at the level of the epidermis. Now, once again, when we are using the insulated needle, then there is no effect at the epidermal level. The effect is mainly at the tip of the needle according to the depth of the needle we selected, the length. Then we are going to have the impact of the skin, and this is used mainly for lifting effect. On the other hand, for the non-insulated needle, all the thickness of the skin is being affected with the radio frequency, and we are going to have more distribution of the radio frequency, and this is used for collagen stimulation, improvement of the surface of the skin, along with the radio frequency emission and tightening of the skin. But the lifting effect is going to be more achieved with the insulated needles. One important factor which is really making a big difference, from my opinion, is the needle quality. If we have the thin needle, then it's going to be much less painful than if you are having more thick needle. The thicker needles are going to be associated with more pain than the thinner needle. However, with the thinner needle, if it is not of good quality, we are going to have this effect. It's going to be bent with the multiple insertions into the skin, and this is not good. So it is really, really very important to have very good quality of needles, and that's why choosing the product you are working with is of utmost importance. Otherwise, you can induce some side effects in your patient's skin. Now, because of this effect, we can see here, I insist that whether we're using the derma rollers or we are using the derma pen and micro pen and the motorized rollers, or we are using the microneedling frequency, all those are having consumables, and this tip or this consumable is supposed to be used only once. I never use it again for the same patient even. Number one, there is no way to sterilize the needles. Number two, with the multiple insertions into the skin, even the quality of the needle is good, we are going to have this wear and tear, and the needle might bend, and this is going to work like a hook, and this can induce minute fibrosis. So please, we have to make sure that those are consumables which are never used more than once for the same patient even. Now, another important thing in the microneedling frequency devices is the insertion mode. So we have manual insertion, which we are using with the derma rollers and the mechanical rollers, the motorized derma rollers, but they are traumatic, and usually we cannot get more than 2 millimeter length of the needle, and it's not very controlled. It depends on the operator, skills and expertise. Then we have some devices which are having spring. They shoot the needles into the skin, and this is definitely one of the most painful types of insertion of the needles into the skin, and it is associated with a lot of pain, and that's why not all the microneedling radiofrequency devices are equal, and they are not all associated with the same degree of pain, although we are talking about the same principles and the same technology, the same procedure, microneedling radiofrequency. But this is much more painful than other types of insertion. Then finally, we have the electronically controlled motorized insertion, where the needles are inserted slowly and smoothly without extensive trauma to the epidermis. And this is the one available with the VIVACE, where we are getting a very smooth insertion of the needle into the skin. And that's why the pain associated with that type of microneedling radiofrequency device is significantly less than with other types of insertions of the needles. As it comes to the pain, there is another factor than the needle insertion, which is the radiofrequency wave. With the radiofrequency wave, there are certain types of manufacturer who are able to get a very smooth wave of the radiofrequency, which is not going to be there while the needle is inserted into the skin. It is not going to be there while the needle is withdrawn from the skin. The radiofrequency is going to be emitted only when the needle is inside the skin. And this is definitely going to be associated with much less pain and with much less trauma to the epidermis, with less significant incidence of complications. So those are two very important factors when it comes to the pain associated with the microneedling radiofrequency devices: the mode of insertion and the wave form of the radiofrequency and how it is emitted in a gradual and smooth mode. The tissue effect of the microneedling frequency is, as we can see here, very much similar to the non-ablative fractional laser. So I can claim easily that anything the fractional non-ablative fractional laser can achieve, the microneedling radiofrequency can achieve equally effective and very safely as well. We can see that this is someone who was treated with the microneedling radiofrequency, and this is immediately how the skin is looking. We can see easily where we treated and where we did not treat. We can go back to treat the areas which were skipped and were not treated before, so that we can get very homogeneous coverage of the skin. However, in 24 hours, we can see the skin back to normal. Usually, this is going to be achieved in few hours, maybe 2 or 3 hours in most of the cases, according to my experience. So that's why I can comfortably say that this procedure is associated with no or minimal downtime. We can improve the static wrinkles. Usually, I recommend 3 sessions, 1 month apart, and 6 months after the last session, we are going to get the final result. And after that, I recommend to do 2 or 3 sessions per year as maintenance. But definitely, this is a significant improvement in static wrinkles, where the fillers and maybe the toxins is not going to be the best tool to improve it. With this, we are getting natural long-term improvement of the skin. We can work very nicely on the periorbital area. It's very safe. Of course, we are going to select needle length depending on the area we are treating. In an area like this, I wouldn't go more than 1.2 or 1.3 millimeter of the needle depth. And as we can see, we can get very nice improvement, tightening and collagen stimulation of the periocular area, as we can see. Stretch marks is one of the biggest challenges in our field. As we can see in combination treatment, where we can use the microneedling radiofrequency in combination with PRP injection, we can get significant improvement in stretch marks. However, it's important to let the patient know that it is not going to go away 100%. We can do something like 40 to 60% improvement, as we can see in this photo, and usually the patients are very satisfied with this outcome. In 2013, I did publish this article in Prime journal, where I wrote an article about fractional radiofrequency with microneedling in treating acne and acne scars. It's an open access article. So if you want to Google it, you can have the full article if you are interested to read about that topic more. We can see that the acne can improve. So we are improving not only the acne scars, but also the active acne can improve with this technology, where we are able to induce some shrinkage in the sebaceous glands, plus the heat of the microneedling radiofrequency is going to also damage the bacteria existing in the area. So this is going to improve the mild to moderate acne, plus improving the acne scars as well. And this is another patient, and we can see the improvement just in a few sessions, where we can get very nice improvement of the skin. The pores are going to improve, the acne scars are going to improve, and also the active acne improves. One of the most significant improvement I have seen for the skin, the skin pores on the nose is achieved with the microneedling frequency. I didn't see similar improvement by any other modality, whether laser or fractional laser or whatever. With the microneedling frequency, you are getting the maximum improvement of the pores, especially on the nose. And this is, of course, a combination treatment where we did treatment of the epidermis with something like the Mirapil, and then we did also the microneedling radiofrequency, and we can see how much the skin improved in 3 sessions, 3 weeks apart. So I think with the combination treatment, we are getting the best outcome for a case like this. And this is another case where we did combination of inducing improvement of the epidermal barrier function, stimulating the collagen and tightening the skin. So with this, we are able to improve the skin significantly. Another case of improving the acne scars in dark skin, where we are able to achieve significant improvement of the skin with the microneedling radiofrequency, along with improving the epidermal barrier function. Tightening was not required in this patient because there is no skin laxity. The patient is young. We don't have a skin laxity problem. So microneedling radiofrequency, along with improving the epidermis, was enough to achieve similar result. And this was an interesting article about a split phase comparison of fractional microneedling radiofrequency device and fractional carbon dioxide. So half of the phase was treated with microneedling radiofrequency, and the other half was treated with fractional radiofrequency. What was the outcome of that? They were clinically equivalent. So both the microneedling radiofrequency and fractional CO2 were associated with moderate improvement in most patients, and the number of active acne lesions was significantly decreased in both sides. Now, when it comes to this study, they tried to do a second session, but the patients refused. They said, we don't want to do the CO2 again. We are okay to do the microneedling frequency. So the study ended with the 1 session only, and the microneedling frequency was the preferred method because it was associated with significantly less downtime. So now, if we have now a tool which is as effective as the fractional laser, but with much less downtime, definitely we are all going to go for it. So VIVACE, why, when, and how, why I'm choosing that over others. As we can see, the VIVACE is really very unique. It's associated with definitely less pain than other devices I have used. It is associated, or it has a very unique feature, which is the frequency. It has both 1 megahertz and 2 megahertz frequencies. So the 2 megahertz frequency is going to be associated with more superficial effects. So I can target the problems which are more superficially located. The 1 megahertz is going to be going deeper. So if I want to get more lifting and more tightening, then I'm going to be using the 1 megahertz with the insulated needle. For more superficial problems, I'm going to use the 2 megahertz. And this is very unique because most of the other devices are going to be having only 1 megahertz or only 2 megahertz. So this kind of flexibility is definitely very helpful for me. It is the motor, as I mentioned, the motor insertion is associated with very gradual insertion of the needles into the skin, so the pain associated is going to be significantly less with other machines I have used. And also the radio frequency wave is very gradual, very homogeneous. So there is no radio frequency when the needle is inserted into the skin. There is no radio frequency when the needle is withdrawn from the skin. And that's why the incidence to have any microcrust on the surface of the skin is much less with this technology over other micro needling radio frequency devices I worked with. Of course, having the insulated and the non-insulated needles in the same device is very helpful because it gives us more flexibility. I'm using it mainly for generalized rejuvenation. Also, I'm using it for in cases of large pores, acne scars. Sometimes when we have dyschromia and I need to get some collagen stimulation, plus also some of the transcutaneous absorption of bleaching agents because of the dyschromia, then I use the microneedling radio frequency, and then I apply topically some mesotherapy cocktails in order to achieve what I need to achieve and improve the skin. I usually do 3 sessions, 3 to 4 weeks apart. Sometimes if we have scars, we can do on shorter intervals, but in most of the cases, I do 3 sessions, 3 weeks apart, and then we wait for 4 to 6 months, and then we do maintenance sessions, which we do 2 to 3 times per year. Every 4 to 6 months, we do 1 session more. Of course, it's important, as I mentioned before, to make sure that we are working on all the layers of the skin, improving the epidermis, stimulating the collagen with the VIVACE, and also tightening the skin with whatever tool we have in our hand. So with this, I end my presentation and I leave the conclusion for the Pharma team, and then I'm going to be happy to answer any questions you might have.
Many thanks, Dr. Ashraf, for your amazing presentation as usual. And many thanks for all audience for this. I would pass the presentation for my colleague Anna. Yes, Dana?
Good evening. Can you hear me well?
Yes, we can hear you well.
Good evening, everyone. First and foremost, I'd like to thank Dr. Ashraf for this great information and presentation. I'm Dan Azzam, a medical rep from Dar Pharma Company. I would like to start with VIVACE, that VIVACE is considered as one of the most effective and favorable RF microneedling device all around the world, especially in US and Europe. VIVACE successfully gained this advantage from the fact that VIVACE merged between the high efficiency and the great result in one side, and on the other side, there is no pain in comparison to other machines in same category. Moreover, the downtime exemplified in very few hours, from 2 to 4 hours maximum after the session. In the same time, the device considered as one of the best friendly used devices. Now, about the principles and operation about the VIVACE, the high frequency energy, we have 2 different high frequency energies, the wide wavelength, 1 megahertz, and the narrow concentrated wavelength, 2 megahertz, generated from the main body of VIVACE, that is transmitted to the tissue through the handpiece and bipolar type electrode. This transmitted high frequency energy generates heat by load or contact resistance of the tissue. It uses this principle that tissue coagulation occurs by the generated heat. So as I mentioned, that we have 2 different high frequencies, 1 megahertz and 2 megahertz, We also have different LED lights in this needles. The blue color that makes sterilization for the skin and especially used for the acne cases, and the red diode color that's used to stimulate the collagen and elastin. About the applications for the VIVACE, the handpiece, we have two different needles. The first one is the blue insulated needle, and we can use it for lifting and tightening cases. And the other red non-insulated that's used to treat acne, pores, post-acne scars, and stretch marks.
Thank you, Dana, so much.
Thanks.
Okay. Yes, as Dana mentioned, most of the benefits of using VIVACE over like other devices, or usually in like the microneedling radiofrequency species. Now I would like to just quickly go through the highlights or the rationale behind that, why VIVACE can generate better and efficiency, and why VIVACE considered as a very safe device in comparison to other devices. So I will gonna start with the fact that VIVACE has like a 36 needles arranged in like a certain way with very high quality, and it's coated by gold. VIVACE, one of the features of VIVACE of having like insulated and non-insulated, as Dr. Ashraf mentioned and my colleague Dana, this gives like variation of the usage for doctors. They can use VIVACE in different applications and for different cases. And along with one of like VIVACE very important features, that it has like a micro memory motor. Micro memory motor, this is the advantage that minimize the side effects, and in the same time it's giving like soft penetration to reduce the pain and accurate penetration. I'll just try to explain how micro memory motor work. The micro memory motor is like a device inside the handpiece, and this device ensure that the radio frequency will not go out unless if the needles like penetrated inside the skin. And this will help us in two things actually. It will help us to gain the benefits of using the session and make sure that doctor will reach to the depth, the required depth from 0.5 to 3.5, and in the same time it will like protect us from having any burns or any like stamps or side effects inside on the superficial layer. Along with like some friendly used advantages, like the handpiece is light, we have like dual hand and foot like switches, and in the same time the LED light, red and the blue diodes. In general, VIVACE considered as one of the best devices for the users. After they use it, they like it, and the safety is certified by FDA, ISO, and CE. I hope that all of the attendances like the presentation and it get benefit from the information that shared about the device and about the about the RF microneedling in general. Now, if you allow us, we will move to the part of questions and answers, and I will keep the arrangement for this to my colleague Dana. Yes, Dana, can you hear us?
Can you hear me?
Start the questions?
Yes. I'm here with our supervisor, Dr. Rihab.
Hi, everyone.
Excuse me, Dr. Ashraf, there is some questions we have received. I'd like to start with the first question about the parameters that are used in each case.
It's a very good question. There are a few parameters which we need to select from. Number one, the selection of the tip. Are we going to use insulated or non-insulated tip? And this is going to depend on what we want to achieve in the skin. If we want to achieve mainly lifting, then we are going to use the insulated tip, because with this we are having focused heat or radio frequency at the tip of the needle only. If we want to improve generally the skin, then we are going to use the non-insulated needle, because in this case the radio frequency is emitted along the whole shaft of the needle. So this is number one. Number two, we are going to be doing the depth of the needle. At the depth of the needle, we can select anything between 0.5 up to 3.5 millimeter. So it's going to depend on the thickness of the skin and how much we want to insert the needle into the skin. So this is going to be very much variable. Average, I use 1.5 to 2 millimeter in most of the cases. If there is fibrosis and a scar, then we can use a little bit more. If you are working on more delicate areas like the neck or the periocular area, then we can go only to 1.2, 1.3 millimeter. Then we have two more parameters, which are the intensity of the radio frequency and the duration of the RF. So the duration, usually I go around 300 milliseconds, and this controls the duration of the emission of the radio frequency. The more we have, then the more heat is generated. So we are going to have a wider radius for the heat and more effect, more tightening effect. The shorter, the less it is. So this is regarding the duration. And usually I use 300 to 400 milliseconds. If you want to be more conservative, then you are going to go for 200. If you want to be a little bit more effective, then you go for 300 or 400. Now the intensity of the radio frequency is around 4 or 5, and this is usually the how much radio frequency you are getting. The more we are getting, the more heat is going to be generated. So again, if you are using 4 or 5, this is going to be the average, and I think in most of the cases this is going to be suitable. I hope that answers the question.
Thank you, Doctor. Excuse me, Dr. Ashraf, I'd like to mention that if anyone would like to take a screenshot or capture for this information, please, if you have any questions or anything about the certificates later on, please don't hesitate to email us in this email or by this number on the WhatsApp. The second question, excuse me, Doctor.
Okay, Doctor, we have a question from Dr. Sajna Muhammad. What is the difference between Scarlett and VIVACE?
I think we answered that question, but mainly VIVACE is having both 1 and 2 megahertz, and this is allowing better control in the when it comes to the depth of the effect and the generation of the radio frequency. So if you want the effect to be deeper or superficial, we can alternate between 1 and 2 megahertz. This is the major difference. Scarlett was one of the first microneedling radio frequency devices I used, and definitely this was more than 10 years ago. So with the VIVACE, with a more advancement in the technology, it is something which is more refined and with more options. And I think it is associated with a little bit less pain.
Okay, we have another question. Can microneedling RF be done if the patient has grade 3 of acne or acne scars?
Say that again, please. What is the question?
Okay, question by Dr. Mona. Can microneedling radio frequency be done if patients have grade 3 of acne and acne scars?
The classification of acne is different than the classification of acne scars. For acne scars, any acne scar can be treated with a microneedling radiofrequency. For active acne, mild to moderate cases can be treated, sometimes in association with the other topical agents for treating acne. For severe acne, I think it is not the best scenario to depend only on microneedling frequency. In this case, we might need to go for the isotretinoin treatment.
Okay, another question. In acne treatment, do we use it after systemic medication, or we can start with microneedling RF?
What should we use after the systemic medication, the microneedling radiofrequency?
Yes. Can we start with microneedling radiofrequency?
Actually, it is a good combination with any modality of treatment, whether we are going for systemic treatment or with topical treatment. Microneedling radiofrequency is going to have synergetic effect, and it can be used at any case and any phase. Even during the isotretinoin treatment, even if someone is taking Roaccutane, there is no contraindication to use the microneedling radiofrequency at all.
Great. And there is a question for any benefits for rosacea patients from using microneedling RF.
As a matter of fact, sometimes those patients are getting benefit because with the radiofrequency emitted with the microneedling, we're getting some coagulation of the blood vessels, so the hyperemia is going to decrease. It is not a contraindication. On the contrary, sometimes patients with rosacea are going to get some benefit. Of course, we need to make sure that they are taking the appropriate treatment for the rosacea, whether systemic treatment or topical treatment, but the microneedling frequency is not contraindicated in cases with rosacea. On the contrary, they might get some benefit.
We have another question: how to select patients?
Patient selection is very easy in case of microneedling frequency because it is easily indicated in any case where we need to improve the quality of the dermis, where we need to improve scars, where we need to improve large pores or static wrinkles. In all those, it is a very good indication. So I'm not seeing any contraindication. Maybe pregnancy is a contraindication because I don't want to use any energy-based device during pregnancy, because if there is any concomitant congenital anomaly in the baby, we are going to be blamed. So this might be the only contraindication if the patient is pregnant.
Okay. Well, what's your experience with melasma cases in darker skin types with VIVACE?
In melasma, we have to understand that the objective of using microneedling frequency is twofold. Number one, we are improving the quality of the skin. So we are stimulating collagen. The skin is going to be firmer. It's going to be looking better in general. On the other hand, when we do the microneedling frequency, the transcutaneous delivery of any bleaching agent or any serum or product which is having a lightening effect is going to be much better. And that's why I think it's a good thing to do. However, it's very important to let the patient understand that this is not a direct cure for the melasma. It's not going to cure the melasma. We can improve the quality of the skin, but we are not going to cure the melasma.
Okay, another question, doctor. Your opinion on hypertrophic scars post-acne on the back?
Hypertrophic or atrophic?
Hypertrophic.
Hypertrophic. This is not a good indication. I think for if it is hypertrophic scars, then we need intralesional steroid injection. And sometimes the ablative fraction might do a better job than the microneedling frequency. If it is severely hypertrophic. If it is something mild, then we can do the microneedling frequency with or without intralesional injection of steroids.
Would you please share with us your experience for the lifting cases and scars while using VIVACE, especially the area around the eye in the lifting cases?
The areas around the eye, there is always a confusion between having dynamic wrinkles and static wrinkles. We need to understand that with the VIVACE, we are targeting the static wrinkles. We cannot work on dynamic wrinkles. This is something which requires botulinum toxin injections. But we can improve the static wrinkles by stimulating the collagen and tightening the skin. So this is something which we can do very successfully. I usually do the non-insulated needles because the skin here is very delicate and very thin. So there is no point of using the insulated needle. I usually use 1.3, 1.4 millimeter length of the needle, and I do 400 milliseconds, and the intensity around 4 to 5. And I do one pass with the radio frequency on, and then I decrease the pulse duration to 100 milliseconds, which is the minimum, and the intensity to 100 or to 1, which is the minimum also. And then I do a couple of more passes where the radio frequency is minimal, so I don't get any thermal injury to get more collagen stimulation. I do that 3 times, about 3 or 4 weeks apart, and we get very nice improvement of the periocular area.
Okay, doctor, another question.
And,
sorry. Okay, another question. Will you do microneedling, radiofrequency, or fractional CO2 for patients with skin diseases characterized by Koebner phenomena like psoriasis or vitiligo?
Actually, when we have a patient who is having a disease which is subjected to Koebner phenomena, it's very important to have very good history taking. And if there is history of Koebnerization, we don't do neither laser nor microneedling radiofrequency. It's contraindicated because Koebner phenomena is a contraindication for any invasive or minimally invasive procedure. If the patient is not having Koebner phenomena, then I can do the microneedling frequency, which is less traumatic than the fractional CO2. But if someone is having Koebner phenomena, we don't do neither of the procedures.
There is a question: how long should we wait if patient did Botox and filler injection before using microneedling RF?
Good question. Very good question. If I did Botox today, I need to wait for 2 weeks before I do anything in the same area because I need to get stabilization of the effect of the toxins. If I do filler, I prefer to wait for 3 weeks before I do any other procedure in the same area. But on the opposite side, if I did microneedling radiofrequency, I can do the Botox after a couple of days when the skin calms, which is going to happen in 1 or 2 days maximum. And the same for the fillers. I can do injection of fillers immediately after the procedure or in 1 or 2 days when the skin is back to normal.
Another question: what is the probability of post-inflammatory hyperpigmentation in patients with darker skin types?
It's almost nil. If it happens, then it is due to operators, fault. Where if we did too much overlap with the radiofrequency, then it might cause thermal injury and PIH. But if the procedure was done properly, then it is not a risk. And over the past 10 years, maybe I saw that 2 or 3 times in more than 10,000 patients. So it's something which is extremely, extremely low incidence, if it is done properly, of course.
Great, great. Doctor, there is any specific pre-procedure and post-procedure regimen that you follow?
Nothing is required, actually. The only thing is, as I mentioned in the lecture, I need to do whatever I can in order to work on healthy epidermis. So working on healthy epidermis will optimize the outcome and improve the outcome of the microneedling radiofrequency. The other thing is that we apply topical numbing cream before the procedure. Some patients can tolerate it without, but in most of the cases, I prefer to have a numbing cream half an hour before the procedure. After the procedure, we apply whatever we need to apply for the skin. If we have hyperpigmentation, then we are going to apply agents which are lightening or bleaching. If we have acne, then we are applying things for acne treatment and so on. So this is something which I have been using. Also, since we started to have the Jensen ampoules and products, we applied immediately after the procedure, and this has reduced significantly the downtime and the erythema which can happen after the procedure. And I'm quite happy with using this Jensen range of products after the procedure.
Okay, doctor, another question. Which head is used for treating hyperhidrosis? The non-insulated?
Very good question again. Actually, in this case, I prefer the non-insulated. However, what I do is that I do different passes at different levels. So I start with 3.5 millimeter. I do one pass on the axilla, and then I do another pass with 2.5, 3, and then 2.5. So in this case, we are able to target the sweat glands in different levels and different layers of the skin.
Mm-hmm. Doctor, what about that how can we determine the overlap during treatment sessions regarding to the layers and target for the session?
I didn't understand that question well, but I think it is regarding the overlap. It will depend on the experience of the operator. But the good thing about this procedure is that we are able to see where we treated and where we didn't treat by the erythema, which is happening around the needles. So it is very easy to spot where we treated and where we didn't treat. At the end of the session, we go and cover the areas which were skipped during the session. And by this, we are covering the skin very evenly and homogeneously.
Okay, doctor, excuse me. There is a question regarding to VIVACE versus HIFU. What are the difference for lifting?
Another good question. HIFU is depending on high intensity focused ultrasound, and it is helping in lifting skin. The problem with the HIFU is that the heat generated is about 73 degrees Celsius, and this is associated with photocoagulation, and this is going to be transferred into fibrosis at the end. Whereas when we are using the microneedling radiofrequency, the maximum heat or temperature is about 55 degrees Celsius, and this is not associated with as much fibrosis. So that's why we are able to get with the insulated needles of the microneedling radiofrequency the same lifting effect of the HIFU, but without the fibrosis which occurs with the HIFU. And that's why this is my preferred way for achieving some lifting in the skin.
Thank you, doctor. What about what makes VIVACE downtime is less or no downtime?
As I mentioned before, the wave of the radiofrequency, the wave of emission of the radiofrequency, and the gentle introduction of the needle into the skin are the main factors for making the downtime with the VIVACE less than others. With the others, where the radiofrequency is emitted in a shock form, then it can be affecting the epidermis when the needle is inserted into the skin, or when the needle is getting out from the skin, the radiofrequency is emitted, and in this case we can get microcrusts, and it might stay for a few days or weeks even. So this is not the case with the VIVACE, and that is why it is associated with much less downtime.
Okay, doctor, another question. Will VIVACE help patients with port wine stains?
Actually, it's a very smart question. We thought it might help a little bit due to the coagulation. I did not try it myself, but I think it is something worth trial. There were some colleagues who said that it might work because of the photocoagulation we are able to achieve in the vessels, but I didn't try it myself.
Doctor, there is a question if they could reuse the same tip for the same patient.
I answered that question in my presentation, and I said that this is not a good idea because there is no good way to sterilize the needles which were inserted before into the skin, plus the wear and tear which can happen to the needle, and this can cause minute fibrosis in the skin. So it's not a good idea at all to use the tip more than once, even if it's for the same patient.
Okay, doctor, how can we determine the overlap during treatment session regarding to the layers and target for the session?
I think I answered that question before, Dr. Rahab.
Okay, there is a question. How long after Accutane treatment can we start microneedling RF for scars?
I think we can use the microneedling even during the raw Accutane treatment. However, if we want to be in the best efficacy side, then 1 month after stopping the raw Accutane, we can definitely do the microneedling radiofrequency without any fears.
Will it work for red macular scar?
Yes, yes, it can work because with the heat, we are going to get some photocoagulation of the vessels, so it can improve the erythema associated with the scars.
Okay. Are thinner needles with less distance in between will have better effect and less adverse reaction versus thicker, widely spaced needles?
The more needles we have, the more stimulation of collagen we are going to get. So it depends on the extent of the pathology, and the thinner the needle, the less pain associated. So this is something which you are going to choose according to the pathology in the skin. And the wider needles or the thicker needles are definitely associated with more pain and more bleeding.
Okay, doctor, can we use Vivace for recently tanned skin? Or
yes,
in general, can we use this
there is no interaction with the epidermis. So tanned skin, dark skin, we don't have any impact of the microneedling frequency on that issue at all.
Mm-hmm.
Okay, doctor, what is the difference with Secret between Vivace and Secret? Yeah.
Secret, it is a microneedling radiofrequency device where it has the spring insertion, so it is very, very painful. And this is one of the most common complaint of the Secret device, that it is painful because of the mode of insertion of the needles into the skin. Also, the mode of the radiofrequency is not as gradual as with the Vivace and some other modalities.
Doctor, with Vivace, should we stack on extensive acne scars during the session, and with which percentage for the overlap?
I don't prefer to stack with the radiofrequency on. I do one pass with the radiofrequency, and then I switch the radiofrequency to the minimum possible, and then I do multiple passes again, or I can stack in order to get more collagen stimulation and more degeneration of the fibrosis. So this is something we can do, and usually I do one pass with the radiofrequency on, and then I do another 4 or 5 passes with the minimum settings of the radiofrequency of the device. I have a direct question which came from Dr. Ahmed Shadi, which is asking about the causes of microcrust and how can we prevent it. There are multiple things. The device is having a role. So the homogeneous generation of the RF is a very important key, because the radio frequency is not going to be emitted while the needle is inserted into the skin, nor when it is withdrawn from the skin. But another 2 important things to prevent the microcrust is, number 1, make sure that the skin is very dried. It's dry. There are no remnants of the anesthetic cream on the skin, because if this is the case, the needles, the radio frequency is causing a spark, and this can cause microcrusts. The other thing is that the insertion of the needle, you have to make sure that you are not inserting, you are not putting or removing the tip from the surface of the skin, except when the needle is withdrawn. So if you are withdrawing or moving the handpiece from one spot on the skin to another spot on the skin while the needle is outside the tip, you are going to cause microcrusts. So it's really very important to make sure that the needle is completely withdrawn into the handpiece before you move your handpiece from one spot to another. Because many people are rushing and moving the handpiece from one spot to another while the needle is still inside the skin. And this is definitely going to cause a microcrust.
Okay, doctor, and there is a question from Ali. He's asking, can I adjust the depth of the insulated microneedle and use it in the epidermis layer?
If we are inserting the needle into different depth, so we can set the machine on certain depth. And then after we finish the first pass, I do a different depth, for example, 3.5. And then I finish the pass, and then I set it at 3. And then I do another pass. And then I set it to 2.5. And I do a third pass. Then in this case, we are not causing a thermal injury, especially if we are doing the insulated needle. I'm just doing passes in different layers of the skin. So this is going to be helping if we are doing something like lifting of the skin. I hope that answers the question.
Clear enough, yeah.
Okay, doctor, setting for stretch marks.
Setting for stretch marks, we need the non-insulated needles. We need about 400 milliseconds and intensity of 5. And then the optimum result is going to be achieved by both microneedling radiofrequency in association with PRP injection. This is going to be the best result. We need to do 3 sessions about 3 weeks apart.
And there's a question, is it good to do at 3 different depths to get better results?
Depends on what are we talking about. If you are talking about something like the hyperhidrosis, definitely yes. If you are talking about just rejuvenation and improving the wrinkles, I don't think it is required. So it depends on what is the indication.
Yes, yeah, this is all the questions here. I don't think so there's any new question.
There is another question about pinpoint bleeding. How can we adjust VIVACE to keep pinpoint bleeding in all patients? Actually, we are going to get more pinpoint bleeding if you are minimizing the RF setting. So if I'm using longer depth of a needle, like 2.5, and the radiofrequency is put on minimum, then we are going to get pinpoint bleeding. If I'm increasing the radiofrequency settings, the duration and the intensity, then there will be photocoagulation or thermal coagulation. And in this case, we are not going to get bleeding. So if you want to see blood, then minimize the RF intensity and duration, and then you are going to see the blood.
Doctor, do you treat red or white stretch marks?
Sorry?
Do you treat red or white stretch marks?
Both. We can treat both.
Mm-hmm. And there is a question if we could use VIVACE on the body.
The body, of course. Stretch marks is in the body. We can use it wherever. So depending on what indication, if we have scars wherever in the body, then we can use the VIVACE. If we have stretch marks, we can use the VIVACE. There is no contraindication for using the VIVACE in any area in the body.
Can be given for session.
The voice is not clear, Dr. Rahab.
Okay, again, doctor, what are minimum and maximum shots can be given per session?
Minimum is 1. Maximum, there is no maximum. I mean, it depends on the indication. If someone is having small, tiny scar, isolated scar, then we are going to do 1 or 2 pulses. But there is no maximum. We don't have any maximum point.
Okay, there is another question. I think we answered part of it before, but it's about the protocol of hyperhidrosis treatment, power level RF and LED and megahertz.
So 1 megahertz, because we need deeper effect, is going to be insulated. I do 3 passes, 3.5, 3, and 2.5. So 1 pass with each. The intensity is 5, and the pulse duration is 400 to 500. So this is what I do.
And which LED, doctor, red or blue?
Red.
Okay.
And Dr. Farida asking about the minimum and maximum shots that can be given per session.
I answered.
Oh, okay.
There is, I think, an important question. We can use the VIVACE for plantar and palmar hyperhidrosis. I think it is too painful. It's a too painful procedure. I don't think it's going to be that effective for the pain associated. So I think for this kind of hyperhidrosis, the iontophoresis devices for home use might be the best. I prefer it even over the Botox injection.
Hey, doctor, we have a question. What about reports of cases with hypodermic fat atrophy, and what was the etiology? Okay, you hear me, doctor?
Yes, I can hear you, but I didn't understand the question.
Even me. What about reports of cases with hypodermic fat atrophy, and what was the etiology?
Reported cases of what atrophy?
Hypodermic fat atrophy.
With the microneedling radio frequency?
Yes.
I didn't hear about anything like that. It can happen with the bulk radio frequency if it was done for too long and high temperature. But with microneedling radio frequency, I didn't read any reports about similar incidents.
Okay, any contraindication for implants?
For implants?
Yes.
There is a continue for the question, like dental implants or any electric implants.
No, because we are using here bipolar radio frequency. So the monopolar radio frequency is a contraindication in cases of pacemaker, but not the bipolar radio frequency. And if there is any dental implant, this is much deeper than the depth of the skin where we are inserting the microneedling radio frequency needles into. So there is no contraindication in this case.
Doctor, do you have any experience for scalp hair restoration?
With the microneedling radio frequency, I don't think this is a very good idea. We can do microneedling associated with plasma inject PRP, but I don't think that we need radio frequency for that. At least this is my opinion. I didn't read anything about such a study, but I would say that microneedling is good. I don't think we need radio frequency to stimulate the hair growth.
Okay, and what about the depth of microneedling difference in males and females? There is any difference?
It depends on the thickness of the skin. We might have a male who is having delicate and thin skin, and we might have a female who is having a coarse and thick skin. So this is the only determining factor for the depth of the needle, the thickness of the skin, and the depth we need to go for. So if I'm working on the periocular area in a patient, male patient or female patient, then I'm going to select the needle depth according to the how thin the skin is. As I said, thickness of the skin is the main determining factor regarding the depth of the needle.
Doctor, what about if we can do fractional CO2 in the same session with the VIVACE in case of acne scarring?
I don't think there is a value of that because those are two values in order to stimulate the collagen. So there is no point of using the same, the same objective technologies at the same session. I don't think there is added value. It's just like if we ate and we are already full. If someone is offering us food, we cannot eat anymore. The same applies for the skin. If you are doing a procedure to stimulate the collagen, and then I do again another procedure to stimulate the collagen at the same session or closely after, the skin is not able to react. So it is much better to use different technology for different layers of the skin with different objectives than using multiple technology for the same objective at the same time. It's going to be useless.
Okay, doctor, what do you advise after VIVACE session for acne scars?
For acne scars, topically, we prefer to use some of the mesotherapy vitamins or the Janssen products, which are having, moisturizing effect, stimulating the healing of the skin. So stem cell cocktail or fluid from Janssen is one of the best products I use. It calms the skin, it helps in the regeneration of the cells. So this is something which I usually do. Some cases of acne scars where we have rolling scars, I do in association with the VIVACE subcision because this is going to improve the rolling scars, and at the same day we do the subcision as well as the VIVACE, and it's giving very nice results.
And doctor, can we use VIVACE for all skin types?
Yes, of course.
And they are asking if there is any comparative studies between VIVACE and fractional ablative lasers.
Who is asking that question?
Dr. Sandeep Gupta.
Okay, Dr. Gupta, this was one of the last slides I presented in my presentation, and please get back to the presentation. There was a comparative study between fractional CO2 and microneedling radiofrequency, which showed in case of acne and acne scars, which showed that both of them are clinically equivalent. However, the microneedling radiofrequency was associated with significantly less downtime, and that's why it is a preferred way over the fractional CO2.
Okay, and Dr. Farida asking if is it okay to advise topical steroids applications post-procedure to reduce the inflammation?
No, Dr. Farida. We said that one of the mechanisms of action is to stimulate a mild inflammatory reaction to get fibroblasts to synthesize new collagen. So if we apply topical steroids, this is going to suppress the inflammatory reaction, and this will decrease the amount of fibroblasts and its activity, so we are not going to get as good collagenesis, neocollagenesis as we need. So it's not a good idea to apply topical steroid after that procedure.
I repeated the question if we could use.
Repeated the questions. There is a new message.
We can use PRP.
We can definitely use PRP along with the microneedling radiofrequency. It's going to be very good synergy, and I think it's a very good idea. We inject the PRP wherever we need to inject it. However, we keep a little bit in order to be applied topically after the microneedling radiofrequency. And yes, someone was asking if this is going to penetrate. Yes, with the microneedling radiofrequency, we are going to get the skin is open for about 90 minutes or more. So during this period, whatever we apply is going to be absorbed very nicely. The skin is going to be like a sponge, even the PRP.
Okay, doctor, if a patient after peeling session wants to make session of VIVACE or microneedling RF, what are the time should separate the two sessions?
I think if we are having an interval of 3 weeks in between the sessions, this would be ideal. Sometimes it can be prolonged a little bit, like 4 weeks. And sometimes in case of scars, we can do it over 2 weeks intervals. But the average 3 to 4 weeks. Does that answer the question?
Yes.
And regarding to the previous question about the steroidals topical, they are asking about the ideal post-procedure application to the that's given for faster healing.
Anything which contains ceramides, anything like panthenol. Personally, I use some products from the Janssen ampoules where it is stimulating the healing. It is giving some nice moisturization of the skin, so helping the epidermal barrier repair. So it is really giving me very nice results if it is available in your countries.
Okay. Is gold stamp with mesopodox will be better after VIVACE or microneedling or before?
Actually, I don't think there is a need to do both because gold stamp is a microneedling device. With the mesobotox, you can apply it after the microneedling radiofrequency without needing the need of gold stamp. So you can do the VIVACE, the microneedling radiofrequency, and after that you apply this mesobotox immediately, and it's going to be the same thing. So there is no point of doing both. With the microneedling radiofrequency, you have the advantage of having the fractional radiofrequency for more collagen shrinkage and more tightening and lifting of the skin. And at the same time, you are having the collagen stimulation of the microneedling, and you have the transcutaneous delivery as well. So it's a much more holistic approach. It's much wider range of application, and in this case, you don't need the gold stamp.
Okay, doctor, last question. Can VIVACE obviate the need of Tyler liberator, fulfill sufficient for deep scars?
Most of the cases, yes, it's going to be enough. What I do is that I do the VIVACE 2 times, and then the areas which improved are improved. The areas which did not improve or get worse, and this might happen in some cases, then we can do the subcision. But other than that, I don't think we need to do anything over that.
Okay, last question. Which
No.
is better to use after?
I mentioned that the last one is the last question.
I'm so sorry, but
You're still receiving.
I'm still receiving. Which is better to use after RF, arnica cream or bipantene cream?
Bipantene is going to, I don't want to stop the bleeding. The bleeding is going to be stopped. The arnica is going to be used if we have bruises, and usually you don't have a bruises. But if you are working around the eye and bruises occurs, then arnica is going to be indicated. The bleeding is going to stop immediately, and then panthenol is going to be a good alternative in order to stimulate the epidermal barrier repair. So arnica is not going to be used unless there is bruises, which is very rarely happening.
Thank you, doctor. Now I have no more questions.
Ahmed, which is about what is better for good result in deep acne scars, thermal coagulation or using low parameters to get pinpoint bleeding. I think thermal coagulation is very important. Pinpoint bleeding, I don't care very much about it, whether it happens or it doesn't happen. I don't think it makes a big difference.
Thank you so much, Dr. Ashraf. As usual, very interested, and thank you for your rich and deep information. And it's like, I would like to thank Kuwait Association of Dermatology, represented by Dr. Abdul Wahab Al-Fawzan and Dr. Ayman Hassanin. And I would like to thank Dar Pharma team, Dr. Dana and Dr. Rehab. And last, I would like to thank all the attendances, and we wish that we can always arrange for such nice webinars to get like up-to-date information and valuable information from Professor Ashraf Badawi.
Thank you very much, Dr. Mohammed. And also I would like to extend the thanks for the Kuwait Dermatology Association for Dar Pharma for arranging this event. Hopefully it was useful. Hopefully all the colleagues are able to get some tips and tricks in order to implement in their practice and improve the outcome of their procedures and the service they provide for our dear patients. So thank you all for your attention.
Thank you.
Thanks all, and would like to say see you.
Thank you. Bye-bye.
Bye-bye.